When we hear Alzheimer's disease, we instantly think of severe memory loss. But the truth is, the disease begins its silent march in the brain years, sometimes even decades, before significant memory problems surface. This is a crucial concept to understand because it means there's a critical window for intervention. During this preclinical or prodromal stage, microscopic changes are already occurring. Amyloid plaques begin to accumulate. These are abnormal protein clumps that build up between brain cells. Tau tangles start to form. These are twisted fibers of another protein that build up inside brain cells. Brain inflammation increases. Neural connections begin to weaken. These changes disrupt normal brain function long before they impact your ability to recall names or events. Your brain is essentially compensating, working harder to maintain normal cognitive function. It's like a finely tuned machine that starts to experience tiny, unnoticed electrical shorts. The lights are still on, but the system is under strain. The challenge is that these early indicators are often subtle and nonspecific. They can easily be dismissed as normal aging, stress, or other conditions. But for those aware of these subtle signs, they can serve as a vital early warning system. Recognizing these earliest whispers is key because it gives us a chance to potentially slow or alter the disease's devastating course. While memory loss is the hallmark of later Alzheimer's, the disease's earliest whispers often manifest in more subtle, non-memory ways. These are the shifts that can be easily dismissed, but that a keen eye might notice. 1. Subtle changes in planning or problem solving. This isn't about forgetting how to do complex math. It's about a gradual increase in difficulty with tasks that require planning, multitasking, or abstract thinking. Examples: finding it harder to manage a budget, struggling to follow a recipe you've used for years, difficulty organizing a simple event, or taking much longer to complete tasks that used to be easy. 2. Difficulty with familiar tasks, even simple ones. A common sign where a person might suddenly struggle with a routine task they've performed countless times. Examples: getting lost driving to a familiar store, forgetting the rules of a favorite card game, or having trouble operating a familiar appliance. This isn't memory of what to do, but how to do it. 3. Confusion with time or place beyond just date. It's about losing track of seasons, the passage of time, or not recognizing where they are or how they got there. Examples: believing it's a different year or month than it actually is, getting disoriented in a familiar neighborhood, or suddenly feeling lost in their own home. 4. Visual and spatial difficulties. This isn't vision problems like cataracts. It's trouble understanding visual images and spatial relationships. Examples: difficulty judging distances, trouble differentiating colors or contrasts, problems reading or balancing due to misinterpreting visual cues. This can impact driving or navigating stairs. 5. New problems with words in speaking or writing. Trouble finding the right word or following a conversation beyond normal tip-of-the-tongue moments. Examples: repeating themselves frequently, struggling to participate in conversations, suddenly stopping mid-sentence or using incorrect words for common objects. Writing can also become disorganized. 6. Misplacing things and losing the ability to retrace steps. Everyone misplaces things, but with early Alzheimer's, it's not just misplacing, it's putting things in unusual places and being unable to logically retrace steps to find them. Examples: putting car keys in the refrigerator or a wallet in a kitchen drawer and having no memory of doing so or how to find it. 7. Changes in mood or personality. These can be among the earliest and most distressing signs. Examples: becoming unusually withdrawn, irritable, anxious, easily upset, or showing sudden, uncharacteristic aggression or suspicion towards others. Losing interest in activities they once loved. 8. Decreased or poor judgment. Making decisions that are out of character or demonstrate poor judgment. Examples: giving away large sums of money to telemarketers, neglecting personal hygiene, or dressing inappropriately for the weather. It's vital to remember, one isolated incident of any of these is likely nothing, but a pattern of these subtle shifts, a consistent change from a person's baseline, especially across multiple categories, should prompt a conversation with a doctor. These are not just senior moments, they are critical whispers from a brain undergoing profound changes.
To truly grasp why these subtle signs appear so early, we need to understand the insidious battle silently unfolding within the brain, long before classic memory loss becomes apparent. This battle is the core pathology of Alzheimer's disease. The two main culprits are A. Amyloid plaques. These are abnormal clusters of a protein fragment called beta amyloid. They build up in the spaces between neurons, forming dense, insoluble deposits. Imagine sticky gum clogging the pipes between your brain cells. These plaques are believed to interfere with cell-to-cell communication, essentially short-circuiting the electrical signals that allow your brain to think and process information. Research suggests amyloid accumulation can begin 15 to 20 years before symptoms. B. Tau tangles, or neurofibrillary tangles. These are twisted fibers of another protein called tau, which accumulates inside neurons. Normally, tau helps stabilize microtubules, which are like tiny railway tracks that transport nutrients and other essential materials within the brain cell. In Alzheimer's, tau becomes hyperphosphorylated, abnormally changed, detaches from the microtubules, and forms insoluble tangles. Imagine the railway tracks collapsing. This disrupts the cell's transport system, leading to cell death. Tau pathology often spreads in a predictable pattern across the brain, starting in areas crucial for memory and then extending. The interplay between amyloid plaques and tau tangles is complex and devastating. Amyloid is thought to initiate the disease process, while tau pathology directly correlates with neuronal damage and clinical symptoms. Beyond these hallmark pathologies, other changes occur. First, brain inflammation or neuroinflammation. The brain's immune cells, microglia and astrocytes, become chronically activated, leading to a persistent inflammatory response. While inflammation is normally protective, chronic neuroinflammation can damage healthy brain cells and contribute to cognitive decline. Second, vascular damage. Blood vessels in the brain can also be affected, leading to reduced blood flow, microbleeds, and contributing to cognitive impairment, often termed mixed dementia, when combined with Alzheimer's pathology. Third, loss of synapses, the connections between neurons where information is transmitted, are lost. This is a critical component of cognitive decline. These microscopic changes don't happen overnight. They accumulate slowly, year after year. The brain, with its incredible plasticity and compensatory mechanisms, works hard to maintain function despite the growing damage. This compensatory effort is why early symptoms can be so subtle. The brain is managing, but it's working overtime. It's only when the damage overwhelms the brain's ability to compensate that noticeable symptoms like memory loss or severe cognitive impairment become apparent. Understanding this silent battle highlights the urgency of early intervention to potentially slow or mitigate these devastating changes. If you or a loved one are noticing a pattern of those subtle non-memory changes, don't wait. Early detection and intervention are crucial, even in these preclinical stages. While there's no cure for Alzheimer's, understanding the earliest signs means we can potentially slow its progression and improve quality of life. 1. Seeking diagnosis, the importance of a comprehensive evaluation. Don't dismiss concerns as normal aging. Schedule an appointment with your primary care physician, explaining your specific observations. Your doctor may then refer you to a neurologist, geriatrician, or a dementia specialist for a comprehensive evaluation. This may include thorough medical history and symptom review, detailed questions about changes in memory, thinking, behavior, and daily function. Physical and neurological exam to rule out other conditions. Cognitive assessments, quick, in-office tests like the Mini-Cog or MoCA to assess various cognitive domains. Blood tests to rule out other causes of cognitive changes. Example, vitamin deficiencies, thyroid issues, infections. Brain imaging, MRI or CT scan, to rule out structural brain changes like tumors, strokes, or hydrocephalus. 2. Advanced biomarker testing, emerging and important. For very early detection and confirmation of Alzheimer's pathology, more advanced tests are becoming available. Amyloid PET scans use a radioactive tracer to detect amyloid plaques in the brain. This confirms Alzheimer's pathology, but doesn't predict symptom onset. Tau PET scans detect tau tangles, which can correlate more closely with symptom severity. Cerebrospinal fluid analysis, a lumbar puncture or spinal tap, can measure levels of amyloid and tau proteins in the CSF. Blood tests for biomarkers, emerging. Newer, less invasive blood tests for amyloid and tau markers are becoming available and will likely revolutionize early diagnosis. 3. Early intervention strategies. Lifestyle is key. While drug treatments for preclinical Alzheimer's are still in early stages, strong evidence supports aggressive lifestyle interventions to protect brain health. These strategies are beneficial for everyone, regardless of genetic risk. Brain-healthy diet. Focus on the MIND diet, Mediterranean intervention for neurodegenerative delay, which emphasizes berries, leafy greens, nuts, whole grains, olive oil, and fish, while limiting red meat, butter, and processed foods. Regular physical activity. Aerobic exercise, 150 minutes per week, boosts blood flow to the brain, supports new brain cell growth, BDNF, and reduces inflammation. Cognitive stimulation. Keep your brain active by learning new skills, reading, solving puzzles, and engaging in intellectually challenging activities. Quality sleep. Prioritize 7 to 9 hours of consistent restorative sleep. Sleep is crucial for clearing amyloid from the brain via the glymphatic system. Stress management. Chronic stress can harm brain cells. Practice mindfulness, meditation, or spend time in nature. Social engagement. Maintain strong social connections. Loneliness is a risk factor. Manage cardiovascular risk factors. Aggressively treat high blood pressure, diabetes, high cholesterol, and quit smoking. What's good for your heart is good for your brain. Early detection, coupled with these proactive lifestyle changes, offers the best hope for preserving cognitive function and influencing the disease's trajectory. Don't let the fear of a diagnosis prevent you from taking control of your brain health. The conversation around Alzheimer's is often clouded by fear and misinformation. It's crucial to debunk common myths and empower yourself with accurate knowledge to take control of your brain health future. Myth 1. Alzheimer's is just normal aging. Reality. While some memory decline is normal with age, Alzheimer's is a disease. It involves specific brain pathologies, amyloid plaques, tau tangles, that lead to significant, progressive cognitive decline far beyond what is considered normal aging. Recognizing this distinction is vital. Myth 2. There's nothing you can do about it. Reality. While there's no cure, the extensive research into early intervention and prevention strategies is incredibly hopeful. As we discussed, powerful lifestyle factors can significantly reduce your risk, slow cognitive decline, and even impact the underlying disease processes. Your daily choices have a profound impact. Myth 3. Memory loss is the only early sign. This is the most dangerous myth. As we highlighted, subtle changes in planning, problem-solving, navigation, language, mood, and judgment can appear years, even decades before noticeable memory issues. Being aware of these non-memory signs is critical for earliest detection. Myth 4. If it runs in your family, you'll get it for sure. Reality. While genetics play a role, especially for early onset forms or specific genes like ApoE4, genetics are not destiny for most people. Even with a genetic predisposition, lifestyle factors can significantly influence whether you develop the disease and how it progresses. Many people with a genetic risk never develop Alzheimer's, and many without a genetic risk do. Myth 5. It's only for very old people. Reality. While risk increases with age, early onset Alzheimer's can affect people in their 30s, 40s, or 50s, though it's rarer. More importantly, the brain changes associated with Alzheimer's can begin silently in middle age, long before any symptoms appear. Prevention starts young. Empowering your future. A proactive mindset. Embracing a proactive mindset about brain health means shifting from fear to empowerment. It means understanding that your brain health is largely within your control, influenced by your daily choices and ongoing vigilance. Brain health is whole body health. What's good for your heart is good for your brain. Managing cardiovascular risk factors like blood pressure, cholesterol, and diabetes is paramount for brain health. Lifelong learning. Keep challenging your brain. Learning new skills, languages, or hobbies helps build cognitive reserve, making your brain more resilient to age-related changes and disease. Social connection. Strong social ties and engagement are protective factors against cognitive decline. Loneliness and isolation are risk factors. Advocacy. Become an advocate for yourself and your loved ones. Don't hesitate to seek second opinions, ask for comprehensive evaluations, and push for early detection if concerns arise. Hope in research. Remain hopeful. Scientific research is rapidly advancing, bringing us closer to effective treatments and prevention strategies. Your participation in research, if eligible, can also contribute to this progress. By debunking these myths and embracing a proactive, informed approach, you empower yourself to navigate the complexities of brain health, fostering resilience and safeguarding your cognitive future. Don't wait until memories are lost. So here's your crucial call to action. If you or a loved one are noticing a pattern of subtle changes in thinking, behavior, or personality, not just memory, talk to your doctor today. Be specific about your observations and express your concerns about early Alzheimer's. Ask for a comprehensive cognitive evaluation. Embrace a brain-healthy lifestyle now. Adopt the mind diet. Stay physically and mentally active. Prioritize sleep. Manage stress, and stay socially connected. These are powerful preventative measures. And, most importantly, share this message. This knowledge can be life-changing. Talk to your family, your friends, anyone you care about. because recognizing these early whispers could make all the difference, allowing someone to fight back and preserve their cognitive vitality. Don't let the silent march of Alzheimer's steal your future. Watch for the whispers. Take action. Be your own best advocate.